Here at ICML, we'll be presenting the final report of the pivotal trial for Waldenström's macroglobulinemia. This was a very exciting trial because it involved symptomatic, previously treated patients with a median of 2 prior therapies, and in fact 40% of the cohort had refractory disease. So if you think about that, this is actually a very sick population of patients. Despite that, what we observed was that Ibrutinib was very, very active. We had an overall response rate of 90%. We achieved major responses in 78% of patients, and even VGPRs were observed in 29% of all patients. What we also observed in this trial was the impact of genomics, and that's really a very important observation because it will allow us to take that information and help develop a personalized medicine strategy. The patients that had no MYD88 mutation really showed only minor responses and even early progression-free survival. Those that had the MYD88 mutation, what we saw was if they also had a CXCR4 mutation, which is quite common in Waldenström's, those patients tended to show a slower time to achieving a major response, but also the deep responses measured by the major response rate or the VGPR rate were considerably fewer. In addition, we also observed among the MYD88 mutated patients, those that also had the CXCR4 mutation showed earlier progression-free survival, although that being said, it was somewhere in the neighborhood of about 4 years' time. 75% of those patients that only had the MYD88 mutation remained progression-free at 5 years, and the overall progression-free survival at 5 years was 54%. Overall survival was 87%. At 5 years. You really keep in mind that this was a heavily pretreated population of patients, and what's important to come away from this study is this identifies that Ibrutinib is the most active single agent that we have in the treatment of Waldenström's macroglobulinemia.